Is your child always getting into things? You can hardly go anywhere because then they're either interrupting, they're disrupting, they're pulling down things. Well, I am Dr. Lamferndi. I am a pediatrician and founder of Generational Wellbeing. If you're new here, welcome. I post videos on this channel on a weekly basis where I talk about kids' health, nutrition, and behavior. And so don't forget to like and subscribe so you can stay updated. So in today's video, we're going to talk about ADHD. Now, over the years as a practicing pediatrician, I have seen a huge number of kids with a diagnosis with ADHD. I think about 9.4% of kids 2 to 17 years in the United States have that diagnosis of ADHD. So today I want to break down and tell you what it is and what to look out for and what you can do to really help and support your kids. So ADHD, it's a neurodevelopmental disorder. It is chronic in nature where the kids are exhibiting a certain set of behaviors that is affecting their lives, not only at home, but at school, with parties, with play dates and stuff. These kids are not able to control this behavior, so it show out as kids who are either have bad behavior or they're rude. It shows out like these kids are not able to do anything. So when we talk about ADHD, we break down the behaviors into 3 different subtypes. So you have those kids who are maybe in the inattentive group. So these are not necessarily the ones who are bouncing off the wall and interrupting or destroying property or stuff. These are the kids who will be quiet in class. They just stay there. They're daydreaming all day. They're easily distracted. They're not listening. So they look at the teacher as though they're listening, but they're really not hearing anything. These are the kids that are forgetful. They just lose stuff all the time because they're not able to focus or pay attention long enough to get anything done. With these kids, then, because they're not necessarily interrupting or interfering with classrooms, it's easy to miss these kids because they're the quiet ones, but they're doing not too well with their schoolwork because they're not listening or they're not hearing. They don't do well with completing tasks. They get in trouble because they either forget to do what you tell them to do, or they forget their assignments. They lose those are the kids you buy multiple water bottles for, or you have to buy jackets every week almost because they keep losing stuff because they're so easily distracted. Now, the second set of kids are those who are hyperactive. So those hyperactive kids, those are the ones who really get in trouble. Those are the ones that you probably get a message from your child's teacher every day, come get your kid, because they can't sit still in their chairs. So these are the kids who are just motor activated. So not the ones that are sitting there, sitting quiet, but those are the ones who are bouncing off their chairs. They want to pull something. They want to jump. They want to bounce off the wall. They're bringing stuff down and stuff. So those are the kids that are just so hyper. They want to keep moving. They have this inclination, I can't stop moving. And I see these kids even in office as a pediatrician, where you walk in the room and you find the kid just touching stuff. They're touching a light fixture here. They're turning on, flipping off switches here and there. So because they have that inclination to move. And then you have the third group of kids who are the very impulsive ones. These get in trouble too, but more so because they cannot wait to take turns. They want to talk out of turn. They're not waiting for you to finish a sentence. Those are the kids who will interrupt you at all times. They can't wait for their turn. They want to just go and do things at any time, right? So these kids to get into trouble because you get notes from school saying, oh, they're interrupting class, they're talking out of turn, they're not taking turns, and all of those because they're so impulsive that they can't wait. They can take their turns and just wait for their turn to come and then be patient enough to wait. So those are the 3 subclasses of kids. Now, you can have one or a combination. So when we say either just an inattentive type or a combined type where you have a combination, or you have an inattentive and impulsive, or inattentive and a hyperactive type. So all of these kids, sometimes, again, the biggest thing is that these kids, these behaviors is not appearing only in one setting. It's appearing in multiple settings. So when you get at home, you can give your child an instruction to do something, and they either do not hear you because they're not really listening, or they're not even paying attention. So they get in trouble at home, but at school, the same thing. If they go out for a birthday party, the same thing. They go out for play dates, the same thing. I've had parents were like, I can't even get them to a play date because you just give them like 5 minutes and they're fighting. They can't really build or nurture relationships with others just because they're not able to, again, take turns. And with kids, if they find that you're not taking turns, you're not playing fair, and the play date is over. So it stuff that affects kids across different areas, and it really affects them as far as their schoolwork and all these other places. Now, every kid, before I get into what to do and what not to do, is like understanding also that every kid at some point will exhibit one or a few of these symptoms, right? Where there are times when many times my kid would interrupt me. It doesn't mean that they have ADHD. There are times when they're just at a place where they have so much energy pent up, they want to bounce off the wall and they're excited and stuff. And that will happen here and there across the board for most kids. The key difference between a normal, thriving kid and a kid who really has the ADHD diagnosis, it's how it's affecting their life in different areas. It's affecting school, it's affecting relationship with friends and with siblings. It's affecting so many different areas. That's where we're in that place of ADHD. Now, the biggest thing with these kids is that they're really misunderstood. And as a parent, understandably, it is really frustrating because your whole routine is changed. So imagine if like every other day they're calling you, come pick up your kid. Imagine you can't really go to the grocery store because you take that kid in there. It becomes like a battle just to do anything. So it becomes really frustrating because you can't do anything as a parent. And sometimes out of that frustration, we can then start either labeling the kid. We're like, this is a bad kid. Oh, this kid is lazy. Or this kid does not know how to do, never completes their schoolwork. Which again, that, yes, out of frustration, but that just makes it worse because now these kids are internalizing them like, oh, I am bad. This is who I am. And it makes the behavior even worse. Or sometimes then we can even start comparing these kids with their siblings. Like, if only you could be like your sister or your brother who has it all together, who's organized, and you on the other side, you drop all your clothes on the floor and you lose your water bottle every single day. And sometimes again, that just makes it where they feel like you love that particular sibling more than them, and that really reinforces that behavior. So the things that you should not really do is really not try to label it or try not to compare them with other kids or their other siblings, because that really makes it worse. And then finally, one other thing that you don't want to do is really punishing them, because punishing doesn't fix it. I've seen kids who have been punished go sit in a room, they'll find something to bang the wall in the room. You punish them, go do this or do that, it just reinforces the behavior and makes it worse, because it's not like they're just trying to be bad. It's not like they're really trying to do all of those things. It's just they have this innate desire to move, or they have a different way of processing information, so to speak. So how then can you help the kids who have ADHD? One, I would say start with routine and structure. Every child really thrives with routine, but these kids in particular will thrive better if they have clear structures and clear expectations. So you may have to have that routine, whether it's starting out with picture reminders everywhere, like this is what we do when we wake up. We don't want to change things in long, because remember, the attention span is like this little. So if you want to start changing things every day, it's just helping that chaos in their minds. It's just helping everything. I was like, I don't remember, are we doing this today? Are we doing that tomorrow? So creating some sort of a routine, especially on weekdays, where it's like, okay, we wake up in the morning, this is what you do. You line it down where it's the same, it's like routine, and it's easy for them to kind of get through it. Second thing you want to do is you want to be able to talk to their teachers. You want to make sure that you and the teachers are on the same page, because once you have that connection with the teachers, And then once they get to school or from home, maybe the teachers who have their eye on them, maybe they'll have them sitting at a place in the classroom where it's free from distractions. Remember, these kids are easily distracted. You don't want your kid with ADHD at the back of the class where they can see everybody's head in front of them. They can see the windows. Those kids who are distracted, they're probably staring out the windows the entire day. So you want to talk to the teachers and make sure that they are sitting in a position in class where the teacher has an eye on them. It can limit or reduce the amount of distractions that's surrounding them. So you want to make sure you're not doing it alone, but talking to the teachers, because teaming with them, they can really help out. That way we see what's working for them at school and we're mirroring it so that routine is not very different. Now, the third thing is that you want to make sure that we are celebrating progress and not the overall outcome. You may have a kid who's easily distracted, but the fact that, yes, they cleaned that table, I would encourage that rather than like, oh, you didn't clean it well, but rather come back and say, okay, let's do it this way. Celebrate that progress. You might be a kid who ended up with a C. Well, good job, you didn't get a D or an F. Now, what can we do to make sure that we're slowly making progress each day? So you want to celebrate and encourage that, because that's some sort of positive reinforcement that goes against like you're a bad kid or you don't do anything, you don't know how to do stuff, but you're celebrating knowing that this kid has their own unique track and we're just kind of celebrating one step at a time to make sure they're going in the right direction. Positive reinforcement goes a really, really long way with the kids who have ADHD. So, do you have a parent or you have a child who has ADHD? Do you have a story you want to share? Leave a comment in the comment box. Let me know what helps with what works for your kid. And as always, you want to talk to your child's pediatrician. That way, if they need some sort of cognitive behavioral therapy or any other kind of therapy to kind of help them, of course, that is always available. Thank you for listening. Don't forget to like and subscribe.